Okay, let's do this deep dive. We've got this collection of articles, research papers you've shared, all centered on infertility, a really important topic.
Absolutely. And looking through them, they seem to really zero in on one particular area, unexplained infertility.
Right. That really frustrating situation,
Yeah.
you know, where you've been trying, you do all the standard tests.
And everything looks normal, on paper at least.
Exactly. But pregnancy just isn't happening.
What?
And there's no clear reason why, which is tough.
It really is. And that's the core question these sources seem to be tackling, isn't it? Could there be something else going on, something maybe fundamental that we're not usually looking for?
Yeah, that's what we want to get into today. What do these specific sources say about blood flow? Blood flow to the reproductive organs. Could that be a hidden
Oh,
factor?
does it offer any new angles, any
Yeah.
insights for these unexplained cases? Let's see.
So first off, just to set the scene, how do these papers usually define unexplained infertility for anyone listening who might be in this situation?
They're pretty consistent, actually. Generally, it's women, maybe aged 20 to 35, trying for, say, at least a year.
Okay.
And the key things are normal ovulation is happening, the fallopian tubes are open, clear,
Right.
and all the usual checks, hormone levels, basic anatomy scans, they don't flag any obvious problems.
So it's unexplained precisely because those standard tests don't explain it.
Exactly. Defined by the lack of an obvious answer from the typical workup.
And this is where the blood flow idea comes in.
Hmm.
The sources ask, essentially, could issues with blood getting to the uterus or the ovaries be linked to this?
That's the hypothesis they explore. And, biologically, it makes a certain kind of sense when you think about it.
How so?
Well, the papers really emphasize how crucial good blood supply is for the uterine lining, the endometrium. It needs that flow to get ready for an embryo to implant.
Ah, right, for implantation, that critical step.
Totally critical. So the thinking in these sources is, even if everything looks okay structurally and hormones seem fine, if the blood flow isn't quite right, if it's compromised somehow, maybe that microenvironment just isn't optimal for the embryo to take hold.
So that could be the subtle issue hiding behind the unexplained label. Interesting.
Potentially, yeah. That's what they're investigating.
Okay, so how do they actually measure this? You can't just, look inside and see the blood flowing easily, right?
No, exactly. It's not visible on a standard ultrasound scan. They used a more specialized technique. It's called Doppler ultrasound.
Doppler, okay, I've heard of that.
Yeah.
For, checking blood flow in other parts of the body.
Yeah.
Or in pregnancy.
That's the one. Same technology, basically, but applied here to measure blood flow in the specific arteries feeding the uterus and the ovaries.
And what exactly is it measuring? How fast the blood is going?
It's more about how easily it's flowing. It looks at the resistance the blood encounters in those vessels.
Resistance,
Hmm.
okay. And the sources mention specific ways they quantify that, like indexes?
Yes, exactly. They often talk about the resistance index, or RI, and the pulsatility index, PI.
RI and PI.
Think of them as numbers that tell you how much pushback the blood is getting. Higher numbers mean higher resistance.
So higher RI, or PI, means it's harder for the blood to flow into the uterus and ovaries.
Precisely. It's not flowing as freely and not as efficiently.
Got it. And the timing, when they did these measurements,
Yeah.
that seemed important too, based on the papers.
Oh, absolutely crucial. They typically did these Doppler scans during what's called the mid-luteal phase.
Mid-luteal, that's after ovulation.
Right. It's that window when the uterine lining is supposed to be thickening up, getting ready, becoming receptive for a potential embryo to implant.
So checking the blood flow right then gives you a picture of the conditions at the most critical time for implantation.
Exactly. You want to know if the blood supply is adequate when it matters most.
Okay, makes sense. So they used Doppler, measured RI and PI in uterine and ovarian arteries, mid-luteal phase. Comparing women with unexplained infertility to fertile women, what was the big takeaway? What did they find?
Well, the really striking thing, and it comes up repeatedly in the studies reviewed in these sources, is a consistent difference.
Yeah.
Women diagnosed with unexplained infertility tended to show significantly higher resistance values, higher RI and PI in those key arteries.
Higher resistance. So, again, that means blood was having a tougher time getting into the uterus and ovaries compared to fertile women.
Measurably tougher, yes.
Yeah.
Even when other tests were coming back normal.
Wow. So it points to a real physiological difference in circulation that the standard checks just weren't picking up.
That seems to be the implication, yeah.
And you said this wasn't just like one study finding this.
Mm.
The sources suggest it's more robust.
Right. It's not an isolated result. The papers we looked at reference or summarize, I think it was around 8 different studies.
Studies, okay.
And the message coming from them collectively is pretty strong. They consistently link this impaired blood flow identified by Doppler, measuring PI and RI, with unexplained infertility.
So it's a pattern they're seeing.
It appears to be, yes, a recurring finding across different research groups.
And the studies suggest this isn't just interesting data, but it could actually be useful clinically.
Definitely. The idea proposed is that using Doppler to assess blood flow could give doctors valuable extra information.
How so?
It could offer a maybe more detailed look at how truly receptive the uterine lining is, and potentially it could help pinpoint an underlying reason for the infertility that was missed before. It gives you something concrete to look at.
Right, moving beyond just unexplained.
Exactly.
So connecting the dots. If blood flow is restricted, the sources imply this could directly impact the chances of an embryo successfully implanting.
That's the logical link they draw. Reduced blood flow might mean a less supportive environment, making implantation less likely, and therefore reducing the chance of pregnancy.
It certainly makes the unexplained feel a bit less, well, unexplained.
It does suggest a potential mechanism, doesn't it? Which naturally leads to the question, okay, if you identify this issue, what can you do about it?
Do the sources talk about that?
Yeah.
About potential ways forward?
They do suggest that identifying this issue with Doppler could help figure out which women might benefit most from treatments aimed specifically at improving pelvic circulation.
Okay, targeting the blood flow itself.
Right. And one of the sources we reviewed did mention a couple of potential approaches.
Oh, yeah? What were they?
Again, just reporting factually what's in that specific paper. It mentioned acupuncture and also customized herbal medicine.
Okay.
The source described these as methods believed to sort of hyperstimulate blood flow specifically to the uterus, ovaries, follicles, even the eggs themselves.
Interesting. So those are mentioned in the source material as potential options focused on circulation?
As potential options suggested in that context, yes.
Yep.
We're just relaying what the paper presented.
Got it. So bringing this all together for you, the listener, what's the significance of all this information?
Well, if you, or maybe someone you know, is dealing with that unexplained infertility diagnosis, this deep dive offers something perhaps new to consider.
Yeah, it highlights a specific physiological factor, blood flow, that might not be part of this standard fertility checkup.
But it could be playing a really important role. It suggests that unexplained might not always mean there's no physical reason, just maybe that the usual tests aren't designed to catch this particular issue.
Right. It could offer another avenue for investigation, maybe different diagnostic steps.
And potentially point towards therapies focused specifically on improving that circulation based on what's presented in these research papers.
Okay, so to wrap up our deep dive into these sources, the main takeaway seems pretty clear.
Yeah, I think so. These papers strongly suggest that impaired blood flow to the uterus and ovaries, something you can actually detect non-invasively using Doppler ultrasound, looks like a significant potential factor in many cases of unexplained infertility.
And finding this can be useful both for diagnosis, getting a clearer picture,
and maybe for guiding treatment towards improving that circulation. It opens up new possibilities.
Definitely. So that leads us to maybe one final thought for you to chew on after listening to this.
Right. If something as basic, as fundamental as blood flow seems so critical for implantation, what other subtle physiological processes, things maybe easily overlooked in standard checkups, might also be playing a part in fertility challenges that we still label as unexplained?
Is circulation just one piece of a larger, more complex puzzle? Something to think about?